MSD for Mothers is basically MSD's $500 million commitment over 10 years to ending preventable maternal mortality. So 800 women die a day while giving life. We know how to prevent these. 99% of them are preventable, 99% of them in the developing world. So we felt sort of a moral obligation to take this on. But beyond the dollars and the time commitment, the mandate from the top was what happens when you leverage the best of a large pharmaceutical company, its business and scientific expertise, to tackle a global healthcare challenge. So that was the mandate. We're 4 years in, we're in 30 countries, and we've improved access to modern contraceptives and quality labor and delivery services for just under 6 million women. I think I'll focus on digital innovation, as that's the topic of the conference. I think the two solutions that I'm particularly excited about are actually where we're really empowering women. Sort of in the villages, these are the most disenfranchised, disempowered women, often alpha illiterate, but they have a phone in their pocket or in their sari blouse or in their chitenge. And that phone is actually the solution to giving them voice. So in India, for example, India's got the world's largest conditional cash transfer scheme. They have managed to increase the number of women delivering in a health facility, deemed to be the safest place for them to deliver. But they haven't seen the maternal mortality reduction that they expected. And it's because they're not receiving quality of care in the facilities. So we decided to give the women a voice, and now with the use of a phone, they are getting information on what they should receive when they get to a facility, and they're getting to report on the quality of care in an evidence-based way. Otherwise, doctors and people say, oh, well, women don't know what they're looking for. I'm like, well, these women choose one tomato from 20 tomato stalls. They definitely know how to define quality. And what we've seen is this incredible untapped demand. So our pilot was for 300 women, no ad campaigns, no messaging. And in 3 months, we saw 10,477 calls. These women, I went to the village, they were like, we want to report on if we're getting charged extra. We want to report if we were abused. We want to report. I mean, from our perspective, that women's empowerment is so much more important than all the obvious benefits that we're going to get. The other one was in Kenya. Country again, mobile technology is rampant, they're all on the internet, they're using mobile banking. And there we really needed to get critical information around modern contraceptives to these women, especially the girls. So when adolescent girls want family planning, they don't go to see a provider because of the taboo. So these girls and women are getting to choose their contraceptive of choice. They are then told where to go, i.e. where has the product of choice. They then use the fact that not only do they have a phone, but they have a phone powered with money. And the money doesn't get transferred until they report that they got their product and it was a quality service. And so actually what we're doing is really activating the grassroots. So people often talk about disrupting the patient. We're using the patients to disrupt the health system.